I'm Dr. Ali Zaraxida, consultant in the Division of General Internal Medicine, Assistant Professor of Medicine, Mayo Medical College at the Mayo Clinic in Rochester, Minnesota. The title of this article is Sexual Abuse and Lifetime Diagnosis of Psychiatric Disorders, a Systematic Review and Meta-Analysis. This particular paper is currently published online and will be published in the July 2010 edition of the Mayo Clinic Proceedings. So in this study, we attempted to gather and present the best available evidence for the association between sexual abuse and a lifetime diagnosis of psychiatric disorders. The reason we the reason we pursued this endeavor was that while a lot of research exists on this topic, there is great diversity in the methodology of this research, great diversity in the outcomes that are measured, the definition of abuse between papers. So our goal was to try to bring all of that information together and give a concise review of the best available evidence. With that in mind, we conducted a systematic review and meta-analysis. We looked at 8 electronic databases, looked at also published and non-published studies in foreign language studies and English studies. We compared subjects who had a history of sexual abuse to those who did not have a history of abuse. And we also looked for the presence or absence of specific predefined outcomes that, through our review of the literature, we knew were associated with a history of sexual abuse. We found 37 articles that met our research criteria, representing over 3 million subjects. Importantly, we found that sexual abuse was associated with multiple common psychiatric disorders, specifically anxiety disorders, depression, eating disorders, suicide attempts, post-traumatic stress disorder. We did not find an association between sexual abuse and schizophrenia and a formal diagnosis of somatoform disorder. When we did subgroup analysis, we found that most of these associations stood whether the abuse occurred in adulthood or childhood. Furthermore, we found that these associations, when data was available, also stood up or stood whether the abuse occurred in men or women. These findings are important for clinical practice, specifically in the primary care field. We know that sexual abuse survivors have increased cost of medical care, increased medical utilization. And in fact, we also know that they oftentimes have more severe disease than their non-abused counterparts. Yet many of these individuals are seen in the primary care setting. The second important question that this brings up is why are certain abuse victims more likely to develop psychiatric disorders than other victims? We know that variations in genes confer protection for development of psychiatric disorders in abuse victims. For example, the target receptor for the corticotropin receptor hormone is one of those proteins where a variation in the gene can result in a different severity of symptoms. For example, abuse victims who have a certain variation of the gene are likely to have very high levels of depression, as opposed to other abuse survivors who have a different variation in the gene, which have depressive symptoms comparable to those who've never been abused. This opens up a whole avenue of possibilities. For example, is there pharmacologic agents available that specifically target the protein where there's a variation in this gene? Also, if further tests confirm these differences, can we use a screening test to see who is more likely to develop severe psychiatric disorders, and perhaps initiate treatment, whether it's psychotherapy or pharmacologic treatments, earlier in the stage of disease, or perhaps before, prophylactically, before symptoms develop. So what does this mean for the patients? Well, in the short term, it probably gives more information for the physician to be able to recognize a potential treatable disorder that might otherwise not be treated adequately. It will allow more prompt referral and probably better utilization of resources, and ultimately better patient outcome. In the long term, for patients, I think it opens up potential new treatments and new avenues of treatments that may one day, again, help bring these psychiatric conditions or symptoms under control. Our ability to control psychiatric symptoms or severe psychiatric symptoms is really suboptimal. So this potentially could be a very exciting future development for patients with severe psychiatric disorders. So I think the takeaway message from this paper is that abuse history is strongly correlated with multiple psychiatric outcomes. And for physicians, the presence of psychiatric disorders, in addition to healthcare utilization, should really prompt a discussion or investigation of abuse history and a referral to a psychiatric professional for treatment.
We hope you benefited from this presentation based on the content of Mayo Clinic Proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic Proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.